glycolysis, Krebs cycle, HMP shunt cycle, sorbitol's pathway. Okay, now we will study about what is the what and how this sorbitol cycle pathway works. Okay, in this we use the NADP, NADPH, polydegeneration, dehydration, aldose, rectose, glycolysis, monophosphate, hexone, and we will intermediates all the pyruvates and glucose and glycolase and peptose, pentose, fructose, and sorbulate lactase and product is lactase, CO2, C2O, everything, and water and electrolyte transport. What is electrolyte and water transport? Electrolyte and water content of lens resembles in intact cell while that in the aqueous and vitreous resemble plasma. Potassium, sodium, ATPase in the anterior epithelium uses ATP to extract sodium and take up potassium into the cell by active transport. Active transport means the flow of any liquid or fluid from higher concentration to the lower concentration. Amino acids are actively transported into cells. There are three different forms for acidic, basic, and neural amino acids. The transfer of portions and amino acids occurs only at interior surface by active transport and also ionized. So, active transport, glucose transport occurs by simple and facilitated diffusion. Now, we all will want to study about the active facilitated diffusion. Now, factors which maintain the lens transparency. You know, the lens is a transparent. Every optical surface or organ or anything related to optical will and should always be a transparent. If the object or optical surface is not transparent, then the light which are coming from the outside or atmosphere or anywhere in the infinity will not pass out through the structure. Regular arrangement of the lens fiber, lamellar conformation, single layer of the epithelium cells, semi-permeable lens capsule, and high concentration of less glutatine and maintain lens protein in reduced state ensures integrity of the cell membrane pump. And keratogenesis. What is keratogenesis? Keratogenesis is the formation of cataract. How the cataract is formed? Okay, retinal failure, diabetes, severe diarrhea, dietary factors explored to UV relation factors implanted in senile cataract. Okay. Now, firstly, the UV rays are spreaded over or come to our eyes. Okay. then what will happen? Absorbed by the tryptophan. Firstly, the UV rays are falls on the eye, then it is absorbed by the tryptophan, then the tryptophan will pass that to the ensorine K urine, then photosynthesization and protection of free radical oxygen, then down regulation of sodium and potassium ATPs, less swelling and ossification. Now, what happens when the age is increasing? When the age is increasing, then there will be two formulas. First one is decrease in pump mechanism and reduce oxidative reaction कम हो जाए या फिर पंप मैकेनिज्म कम हो जाए. Reversal of sodium and potassium ratio, decreased amino acids, then hydration of lens fiber, decreased protein synthesis. Then what can happen? Denaturation of lens protein, ossification of the cortical lens fiber. ओसिफिकेशन क्या होता है? ओसिफिकेशन मतलब कोई भी चीज़ एक्यूमुलेट होना, ओसिफाई होना. Okay, now we will study about the change in cortical cataract. Cortical cataract, which is where the cortical part is induced. Progressive decrease in lens protein and free amino acid levels in lens. Then decreased synthesis of lens proteins and increased protein catabolism. Decrease in the level of amino acids due to leakage from disrupted membrane. Conversion of soluble proteins into the soluble proteins. The proteins which are insoluble should be taken in low, and the proteins which are in high content can be taken in high level. Soluble proteins will be taken in high level. Then concentration of electrolyte and water content of the lens. Water content increases from immature to hypermature cataract. Sodium and calcium content of the lens increases. Potassium content decreases. Sodium increase होगा और potassium कम हो जाएगा. Okay, now we will study about the nuclear cataract. Nuclear means the cataract which was held or which was came in nuclear region. Dehydration and complication of nuclear brown color of the lens due to the unchromed shots lights. What is the role of glutathione? Glutathione is made up of glycine, cysteine and glutamic acid. Most of glutathione in lens is in reduced form GSH. GSH levels is in cortex is higher than nuclear. HMP shunt pathway generated NADPH which maintains glutathione in reduced state. Lens protein contains reduced sulfatyl groups and oxidated diffused groups. Thus decreased GSM can result in PSH oxidation, alteration in protein, protein, leakage, transparency, and the solubility. Now we will study about the cataract due to uveitis or intraocular surgery retinitis pigmentosa. In uveitis, what is uveitis? The inflammation of the uveal tract, uveal tissues. Influx of plasma contents into aqueous following vitreoretinal surgery, breakdown of blood vitreous barrier, posterior subcapsular cataract. Now in RP, retinitis pigmentosa. RP is retinitis pigmentosa and ROP is retinopathy of prematurity. In retinitis pigmentosa, that is RP, breakdown of the blood vitreous barrier of destruction of pigment epithelium. Plasma phospholipids. What are plasma phospholipids? Plasma phospholipids which are accumulated in our body, that is known as plasma phospholipids. Lysophosphatidylcholine. They leak into the eye from ocular circulation. 2 unsaturated fatty acids and DHA are also implicated. Radiation cataract. Initially, vacuoles appear in the equator and posterior subscapular areas. 3 mechanisms of damage of radiation: increased leakage of glutathione, decreased incorporation of amino acids into proteins, arrest of cells entering mitosis, and epithelial damage. Corticosteroid induced cataract. Steroids induced aberrant differentiation and migration of epithelial cells. Other mechanisms involve evolution of glucose, inhibits glucose dehydrogenase, reduce glutathione, chemical modification of crystalline disulfide across link between lens fibers. Physiology of accommodation. Accommodation is the inability to focus the diverging rays coming from the near object into the retina. Nearest point at which object can be clearly is punctum proximum and farthest point is the punctum remotum, and the distance between them is known as the range of accommodation. The difference in dioptric power needed to focus at a point at near point and a far point is called the amplitude of accommodation. Mechanism of accommodation is there are two theories of accommodation: relaxation of theory and the most accepted theory worldwide, when eye at rest, when eye at accommodates. Eye accommodates. Lens is compressed by capsule due to tension of the nodules due to relaxation of ciliary muscles. These all is about the physiology of lens, how the lens maintains its transparency, how the lens exchange its fluid, how the pathways, cycles bond in the lens. So that's all for today's topic. Any query, then comment in comment box. And by this topic, you will be able to understand about how our eyes, having the lens, is transfer its liquid or fluid from lens to the other particles, other structure of the eye. That's all. Namaste beta. खुश रहिए आप लोग.